Women with a birth plan are seeking a more natural type of delivery usually, and so I always encourage those women to once you have that birth plan kind of written out, go over it with your physician. Really have some good communication about all of the different points that are really important to you on your birth plan. And then each person that desires to use our tubs for labor and delivery will come and have a brief visit with me, and I am there just to kind of answer any extra questions that you have, go over the birth plan. I submit it to labor and delivery just so that they have a copy as well, and really I just serve as just a resource for you when questions come up. You know, if you were wanting to talk with a nurse, it's something maybe the doctor's office didn't answer, but you really want to, have more questions about whatever, then that's what my role is. People are referred to me at any stage of their pregnancy just for help with lots of different things. I have, part of my role is the natural birth liaison for the hospital. So patients come to me, some patients come to me when they already have a birth plan and they've already discussed it with their physician, and they just come to me to, sign off on it, ask me a few questions, and I send it off to labor and delivery, and that's it. Some people I meet with several times towards the, mid to late pregnancy, just to kind of help them formulate their birth plan. Let them know what options we even have available. How do you write a birth plan? So there's some moms who are just overwhelmed. They'll come in my office and we'll sit, for a while and just really, I get to know them, kind of know what they want, and actually help them formulate that birth plan. So it really just depends upon how much help that you're wanting from me as to what I'm available to help you with. So I go from little 5-minute on the phone consultations to, an hour appointments, really, just trying to get to the bottom of exactly what it is that you want, and helping you kind of put it on paper, and, facilitating that communication between you and your physician. Yes, a lot of times I have partners come to the consultations with them, and I really think that it kind of helps that, they see a face with the, the big hospital, and it's kind of nice to have, one person set aside so that they can talk to, and a lot of times the partners have, many more questions than the patient does herself, and so it's kind of nice that they're able to kind of get all of their questions answered as well. Really, those support people, there's a lot of responsibility that support person has, and a lot of times they're very nervous about, kind of what is their role in the whole labor and delivery process, and so I think it's nice for them to come and, meet with me. I validate that their role is very important, and kind of share some tips and some things that they can do to actually help have a successful natural childbirth. A birth plan can really be as informal or as formal as a patient sees fit. A birth plan really is, I really like to refer to it more of like a birth preference sheet, and just to say, this is how I would like for things to go, because every mom wants to have a safe, healthy delivery. And although we can't predict exactly what's going to happen in labor and delivery, we do like to at least have, just some preferences down, like, after the baby is delivered, there's some choices, like, would you like the baby directly placed on your chest, or would you rather the baby go to the warmer, get dried off, and then be brought to you? So those are the types of things, like, where there are some things that, you could have it this way or that way. What way suits you? And so really just kind of having all that out there, it just kind of helps the nurses able to kind of get to know you as a patient better, just to be able to help care for you. So my birth preference sheet, it's, I've had people bring me birth plans on a sheet of notebook paper that just said, I'd like to labor in a tub, and then I've had 8-page birth plans. We'll tell you the shorter they are, the easier they are to, make sure that all of your healthcare team has time to read them. So, I encourage my patients, to keep them brief, but really still to, make sure that they have on there, anything that's really, very important to them. Like, there's no need for you to tell me that, you want a private room. All of our rooms here at Woman's are private. But, whether or not you think you'd like a mirror for delivery can be very, very helpful. We always have the mirrors in the rooms, but the nurse can set it up, have it all available for you if that is indeed something that you want. So just kind of a how you'd like the delivery to go, if everything kind of goes according to your plan. Now, of course, labor and delivery, We never know what's going to happen. So really just kind of, you know, I always encourage my moms to just kind of be real open and just be real flexible. And, you know, of course, we'll try and stick to the birth plan as closely as we can. But just know that, you know, there are some instances where, you know, things come up where, you know, we might not be able to, you know, if the baby might need a little more stimulation right after the baby's born, we might bring the baby to the warmer, dry the baby off, let the baby kind of pink up some, and then give the baby right back to you. But again, it's like just knowing what it is that you want just makes it a whole lot easier for us to make sure that we give you the experience that you desire.